Thank you all very much for joining us today for this press briefing on what the state of Nebraska is doing to slow the spread of coronavirus. We, as always, will start with our reminders to keep Nebraska safe and healthy. We had loosened some of the restrictions we had on our DHMs May 4th, but we still want people to remember that they shouldn't be taking unnecessary trips outside the household is their first rule. Second rule, work in a socially distanced way. Keep 6 feet of distance between yourself and other people at work, or work from home if you can. That's a good deal. 3, if you go out shopping, shop once a week. Don't take the whole family, shop by yourself. Have a list, be efficient, go to the store and come back. Number 4, help kids socially distance by keeping them at home to play and avoiding group sports and playgrounds. Number 5, help seniors by running errands for them, do their shopping so they can stay home, but don't go visit them in a long-term care facility. And number 6, exercise daily, but do it in a socially distanced way or do it at home. Those are our 6 rules to keep Nebraska healthy. And of course, we're always talking about our hospital capacity as well. Again, all these restrictions we put in place have been designed to make sure that we slow the spread of virus so that we don't overwhelm the healthcare system. And we've been incredibly successful in doing that. We have our hospital bed capacity is at 45%, our ICU bed capacity is at 40%, and our ventilator capacity is at 77% statewide. So we want to continue to make sure that we're monitoring that so that we have that hospital bed, ICU bed, or ventilator available for anybody who needs it. That's how we know we're winning. All right, testing schedule. Let's see, we got testing this week for the National Guard is going to be done in Omaha, Wahoo, Fremont, and David City. So, for example, this kind of testing at the One World Center will be National Guard. It's not a Test Nebraska facility, but that's an example of how this testing is going on. And then for the National Guard with the Test Nebraska is going to be in Omaha, Lincoln, North Platte, Scottsbluff, Thedford, West Point, and Dakota City. So we'll be traveling around the state doing the testnebraska.com to be able to continue to promote that program and do more testing statewide. This is also EMS Week, and of course we've been making sure we recognize the folks who are in our emergency rooms, and I'm trying to make sure I got a pen right here, good deal. Recognize the people who are in emergency rooms, who are emergency responders, whether they're the professionals or the volunteers. They are on the front lines of combating the virus. They've got very, very difficult jobs. We are so grateful of all the hard work they are putting in all across the state to be able to take care of people and keep people healthy and safe. And so we want to say thank you to all of our EMS folks. And so I am going to sign a proclamation declaring it a Emergency Medical Services Week here in Nebraska, to say thank you to all the folks who are working so hard to keep us safe. And so here's our proclamation. And we also have Dr. Jim Smith, who is with Great Plains Hospital in North Platte, who Great Plains has been doing a fantastic job of helping us take care of people as well. Just one of the things we've had here in the state is just wonderful cooperation with all of our hospital systems. Great Plains has been no different. They have been great in working with the hospital in Lexington to be able to take patients and so forth. So we really appreciate all their work. And Dr. Jim Smith is the chair of the EMS board. So he is going to come and accept this proclamation on behalf of the EMS board and then say a few words about EMS Week. So Dr. Smith, I will present that to you. Thank you very much.
Good afternoon. My name is Dr. Jim Smith. I'm an emergency medicine physician, and I practice at Great Plains Health in North Platte, Nebraska. I'm chairman of the Emergency Medical Services Board for the state of Nebraska, and I want to thank Governor Ricketts for the opportunity to serve in that capacity and the opportunity to speak with you here today. I first wanted to give you some historical perspective about EMS Week. President Gerald Ford, the 38th President of the United States, a Nebraska native, declared the first EMS Week in November of 1974. So I think this week holds special meaning for EMS providers throughout the state of Nebraska. If you will bear with me for a moment or two, I'll try and describe to you what actually happens in Nebraska when you pick up the phone to call 911. First off, a dispatcher has to quickly try to gather the critical information needed from an often distraught caller to determine which assets to deploy to the location. A law enforcement officer may be the first to arrive at the scene, rendering life-saving treatment in the form of CPR, defibrillation, administration of Narcan for opioid overdoses, or to stop active bleeding while EMS is en route. EMS providers then arrive, and depending on the location, may be a level from anything from a first responder, EMT, paramedic, or even a nurse that is offering to help in the EMS world, along with firefighters that assist in that care and oftentimes have to extricate victims while care is being given to the patient. The patient then is rapidly transported to the emergency department while treatment is rendered in a moving vehicle or the back of a helicopter. That's not an easy task. There, the emergency department hospital staff, often including in-hospital EMS personnel, treat and stabilize patients. Unfortunately, some patients' injuries and illnesses exceed the capabilities of that hospital, and again, EMS personnel are called upon to transport those sometimes critically ill patients to a higher level of care. Here, EMTs, paramedics are sometimes joined by respiratory therapists or nursing staff to aid in the transfer to definitive care. Now that's a lot. That's a lot of moving wheels, that's a lot to do. But I want you to consider this. Those assets couldn't respond to calls without dedicated maintenance personnel to keep those ambulances and aircrafts at mission readiness. There are then ambulance drivers and aircraft pilots that have the difficult task of quickly transporting that precious cargo to their ultimate destination timely and safely. Now, none of this could happen without non-clinical support staff in offices, hospitals, EMS bases, fire agencies, government officials and offices like DHHS, the EMS board, and medical directors all working across the state to support the system. Least we not forget about training agencies. They work tirelessly to keep our EMS staff trained to the best of their abilities. But at the end of the day, some soul has to make the conscious decision to answer the call. The call that means putting their lives and well-being on the line each and every time they do so, especially during our current pandemic. Lastly, there's always somebody left behind, a spouse, partner, child, parent, or friend that watches them walking out the door and wonders if that'll be the last time. They hope and they pray for the patients that they're caring for and for the safe return of their loved ones. Nationally, the 2020 Ems Week theme is Ready Today, Preparing for Tomorrow. This theme was developed long before the COVID-19 crisis. In particular meaningful now is that what the EMS community is doing to support the affected areas by this crisis, all while still responding to the everyday emergencies that continue to occur in their communities. And now they're dealing with new challenges such as lack of access to appropriate PPE and fellow workers who are stricken with this virus. Now more than ever, it is important that we honor and celebrate our EMS professionals who are supporting the health and well-being of our state and our nation, especially those brave individuals who give the ultimate sacrifice with their lives. Thank you.
Dr. Smith, don't forget to take your proclamation with you.
Oh, well, thank you.
Great, thank you very much. Appreciate Dr. Smith, you coming to be able to talk about how important our EMS folks are and their great work and help us recognize them for their work here today, especially during this pandemic. So thank you very much. And thank you for serving as chair of the EMS board. Couple of other things then before we get into questions and answers. Again, we want to remind everybody about testnebraska.com. Please sign up for that. That's a great way for all Nebraskans to participate in fighting the spread of coronavirus here in our state. Sign up for it. Short assessment, less than 5 minutes long, kept in a secure database, not sold to anybody, not given to any law enforcement agency or any other government entity, only to be used for what we're doing with regard to this testing program. It will help us get an idea of what's going on in the state, and that is how we're also going to schedule people to get that test. So please sign up for testnebraska.com. We've got about 143,000 people have signed up, so please sign up for testnebraska.com. And then the schedule for this week, again, we'll be doing English briefings at 2 p.m. Central Time, right here at this this place. And then we will be doing Spanish briefings at 5 o'clock p.m. on Tuesdays and Thursdays. And I will be, again be on NET at 8:30 Thursday night. Speaking of Nebraska, Dennis Kellogg, and we'll have some good guests to join me as well, Dennis and me. All right, so we've got just a few questions here. Michelle Bandur, KETV, one family member of a resident at Life Care Center wants to know what the governor would do if his parent was staying in such a terrible situation, and how would he feel? Folks, I know for the families, this is a tough time, that there's a lot going on with regard to your loved one. We are working with these care facilities to be able to make sure they can continue to provide the care they've been. You know that your loved ones, this is the familiar surrounding for them, and so we are working to make sure that they continue to stay there. We've had some patients transfer, but we are working with them to make sure they've got the staffing they need. And as I discussed on Friday, if we felt the staffing was not going to be adequate to continue to provide that care, that's when we would move people out of that facility. And then, of course, we also announced on Friday that we know this is also going to be an ongoing campaign to fight the virus, especially with regard to our long-term care facilities, and ask for those facilities, we're going to be asking those facilities to come back with a plan to address things such as visitations from families and mental health care and so forth. But we will just, I know it's a tough situation. We're going to continue to work with all these facilities to make sure they continue to provide that level of care. Tyson Hervanik from KRGI. You said consistently the original goal of the DHMs and social distancing practices were not to overwhelm the healthcare system. Given what we have seen in terms of data of positive COVID-19 cases, one would make the assumption that we are past our peak. Given this positive data, are you reconsidering how and when you will relax directed health measures across the state? So we just loosened up some of these restrictions May 4th, and generally you need a couple of weeks of data to be able to know whether or not that's had an impact. And so we're just at that point where we've gone past 2 weeks now. So we're going to be looking at the data and making some decisions and planning for June, and we will be making further announcements with regard to what we will do with regard to those directed health measures as we go through the rest of May and get closer to June. So we are evaluating all that data, and we'll be getting back to make those announcements for what June will look like. Jose Josiah from KETV, what needs to be done in order to use some of the billions of dollars, of the $1 billion the state received from the federal government to help cities like Omaha? They would need to know soon if they're going to get any help. So we, again, this is the CARES Act money that Congress appropriated. We are working on a plan with regard to how that money will be used. And also just a reminder that Douglas County got about $166 million of the $1.25 billion that we received. So the state's got about $1.083 billion that we are putting together our plan around. And I would say stay tuned. We will have announcements on that as we get those plans worked out. Andrew Ozaki, KETV. What are your thoughts on Congressman Don Bacon's bill, the Flex Act, that would allow states and cities to use CARES Act money to address revenue shortfalls? So, okay, so on that one, again, one of the things I said is I could not support additional money that they were talking about in Congress, but Congressman Bacon's idea of taking the money that's already been distributed and allowing that flexibility is something that I think is a good compromise. So I think that the congressman has found kind of a nice middle ground between the folks who want another huge multi-trillion-dollar package and taking the money that's already been distributed to be able to meet some of the needs of those government entities. So I think that that's a good middle ground that the congressman's found. Without that flexibility, how much money will Nebraska have to send back at a time when it might need it the most? So again, we're working on our plan with regard to that, but I don't think there's any expectation that we should have to send any money back. We will be coming back with a plan to be able to use that. Taylor, questions that have been texted in.
Sydney Holzfaster with KPTM wants to know how many tests are being provided, or how are we working with county health departments, and is it enough to keep up with demand?
So Sydney Holzfaster, KPTM wants to know how many tests are we providing to local public health departments, and is enough to keep up with demand? Well, I think, first of all, I think everybody would want to have more tests. But again, this is the point of testnebraska.com, is to be able to provide increased testing. And so that's what we're working. And you can see from the schedule that I laid out, we are moving that around the state to be able to go to different areas. So it's not just, Lincoln and Omaha. We're going to be in Dakota City and Thedford and, other places around the state to be able to provide that testnebraska.com to help expand it. And, we have frequent conversations with folks with regard to the testing. Right now, for example, we're doing a lot of testing in Omaha at One World, so we've been talking with Dr. Poor about that. So we have ongoing conversations to be able to provide that, but again, the whole goal is to increase the testing, whether it's through testnebraska.com or the commercial labs, to be able to provide more testing to our local public health directors.
Don Walton wants to know what criteria are you going to use to determine whether to lift or ease restrictions at the end of this month?
So Don Walton with the Journal-Star wants to know, what are we going to use for criteria with regard to loosening restrictions in June? And again, it gets back to what we've been focused on the entire time, which is that hospital data. Over 2 months, oh, I'm not finished, Taylor, I've got more, hold on. Over 2 months ago, when we talked with our public health experts, right, what they all said is, this is a virus, you can't stop it from coming, you can only slow it down, and make sure that that peak of when you get the most cases is such that you don't overwhelm your healthcare system. And that's what we've done very successfully here in Nebraska. No time was our healthcare system in danger of being overwhelmed. We worked with local health departments and hospitals to be able to manage that so that if we did have a hot spot, we had plenty of hospital capacity. We still have plenty of hospital capacity by the data that I read you earlier today, and we're going to be evaluating that hospital capacity as we look at what do we want to do for June.
Christian Folsom says, last week the White House called for coronavirus testing in all nursing homes and assisted living facilities. Is Nebraska close to testing staff and residents at all our centers?
So Christian Folsom said last week the White House said that, was it White House or was it the CDC? I think it was the White House. It was the White House said that we should test all residents and all staff at long-term care facilities. And our guidelines here are really more around testing the staff. The residents have been in those facilities for a while. So again, it's treated very much like the general public. If you're symptomatic, you're getting tested. And so that's kind of the program we've been going with. And so we are working to do more testing for those staff of long-term care facilities. And then, of course, the residents as that becomes necessary as well.
Grant Schulte has a few questions. He wants to know, what do you think lawmakers should focus on when they return to session?
Grant Schulte asks, from the AP asks, what should lawmakers focus on when they come back for the rest of the session? Two big issues before this whole pandemic hit: property tax relief. That's a big one. We got to get that done. And then the incentive bill. I think those both have to go together to be able to get the votes that we need to be able to pass both of those, or either one of those for that matter. So I think they should focus on property tax relief and getting the incentive bill passed.
He also would like to know, are there other virus-related needs that the legislature will need to address?
Are there other virus-related needs that the legislature will need to address? I don't know of any additional virus-related needs that the legislature will have to address at this time. Obviously, that's always subject to change. Something could happen. This whole pandemic has changed quickly. But at this point, I don't see anything else. The legislature appropriated the money that before they went out of session from the state funds. We are looking to repay that money with CARES Act dollars. So I think we're going to be pretty good with the CARES Act money.
And then finally, for Grant, are you anticipating the need for cuts to the state budget?
And then Grant asks, are we anticipating cuts to the state budget? And of course, we're looking at, there's going to be some sort of impact to the state budget with regard to our revenues. We know that it's going to be impacting what we had previously forecasted. At this point, we don't know the complete picture around that, and really won't know until we get the income tax receipts in that was moved from April 15th to July 15th. So until we get those in, we really are going to have an incomplete picture. So we are going to need to tighten our belts. At this point, we just don't know what that all is going to entail.
And then Michelle Vander had a follow-up question. She says that Douglas County commissioners are calling to, or at least some of them are calling to evacuate the Life Care Center to Midland Hospital. Do you agree with that? And she also says she wants to know the status of a state investigation into LCC.
So Michelle Bander, KETV, is saying at least some of the Douglas County board members are calling for the evacuation of the Life Care Center. And again, what we do is we work with these facilities so that as long as they're meeting the staffing needs, if they've got the staff to be able to accommodate the residents, on a whole, what is best for the residents to stay there, and again, continue to be in a surrounding that's familiar to them, with staff that's familiar with them that can provide that care. If we don't feel like the staffing is going to be adequate, that's when we would move people. So we make these decisions based on staffing and data to make that decision whether or not we would move people from that facility. Oh, and sorry, there was something else there she asked?
She was asked about an investigation.
Oh, and she was also asked about an investigation, and as we said on Friday, when Becky Wiesel was here, is that if there is a complaint against a facility, we cannot confirm or deny if there's a complaint or if there's an investigation until, and this is, by the way, this is a matter of state law, but we cannot do that until after the complaint is completely investigated, and there's been a finding against that company. And when all that's done, if there's a finding against the company, that will be made public. But again, that's just the matter of state law and how that works.
Charlie Brogan from KFR would like to know, are we planning to release demographics of people who signed up for Test Nebraska, such as age or gender? And are we planning to try to promote it with underrepresented groups?
So Charlie Brogan wants to know if we're going to be releasing demographic information with regard to testnebraska.com, and are we going to be promoting it to underrepresented groups? You know, Charlie, with regard to the first part of that question, that's certainly something we consider. We hadn't considered getting into the actual demographics who've actually signed up for testnebraska.com, but that's certainly something we can consider. And the second part, we are absolutely trying to promote this, certainly with the Spanish speaking community, with testnebraska.com/ES. It's our Spanish language portal to doing the test. It's the same assessment. We're encouraging Spanish language speakers, if they prefer to do it that way, to sign up that way. Again, communication in Spanish, arrangements for when you come in, that we have Spanish-speaking folks there to be able to do the testing. So we are looking for, you know, other groups of people to be able to come in through our Spanish language focus, not just on whoever would set up for the regular Test Nebraska.
Bill Shammer, 1011, wants to know if we have guidance on large indoor facilities that aren't partitioned. For example, a business with a few basketball courts, are they limited to 10 people in the entire place?
Bill Shammers wants to know if you've got a large gymnasium that is, got a bunch of basketball courts on it, are you still limited to 10 people at this point in May? Absolutely, that is still the, yes. Putting up a few screens or something like that does not qualify as a new room. You got to have walls and a door and things like that. That was the intention. That was the spirit of the law as we were writing these DHMs. So now will we have additional guidance as we go forward into, say, the month of June and we change some of these things? Yes, we can consider that. But for the month of May, again, I want everybody to focus on 10-person rule. Please respect the 10-person rule. That is part of how we've been able to slow the spread of virus by preventing large groups of people from gathering. And that is what we want to continue to do through the rest of this month.
Don Walton has a follow-up question. Will a spike or decline in coronavirus cases be a factor in determining whether to lift or ease restrictions?
So Don Walton then asked, will a spike or decline in coronavirus cases then lead to a different decision with regard to loosening the restrictions? And I think, again, one of the things you got to remember is we can change how many cases we get by doing more testing, right? The more testing you do, you're going to get more cases. We can get fewer cases by doing less testing, right? Nobody thinks that's a good idea, but you could get fewer cases. That's why looking at case data isn't such a good thing to be able to make these decisions with regard to loosening or tightening up restrictions, because you can, that's a variable that changes depending on how much testing you're doing and, frankly, you know, where you're testing. So what we want to do is look at the things that are not going to change based upon the variable of how much testing you're doing, and that's why we're looking at hospital data, right? Whether somebody gets tested positive or not, or gets a test at all, if they feel like they need to go to the hospital, they go to the hospital. And that's why we look at that hospital data with regard to not just admissions on coronavirus patients, but all patients and where that capacity is to be able to make some of these decisions.
And then finally, Christina Stella with NET says, could she get an update on cases related to meatpacking and deaths related to the meatpacking industry?
Christina Telly from NET would like to, Selly from NET would like to have an update with regard to the food processing industry, total number of cases, and then deaths associated with that industry. Dr. Antone, I know you've got that data, so you want to come up and share that with us, please?
So for the question, according to meat processing employees that have been tested positive, so far in the state of Nebraska, we've had 2,601 confirmed positive cases of meat processing plant employees, and a total of 8 deaths at this time.
Thank you very much, Dr. Antone.
That's all I got.
So you got, all right, so questions from in the room? Paul, I'm looking over you. You're not raising your hand, okay? All right, Paul, come on. I know you can always, I always can count on you to start us off.
Okay, I appreciate that. So Taylor tweeted out that you had a big surge in testing over the weekend. Can we get a breakdown of, where that surge came from? Was it from Test Nebraska? Do you have the numbers for that and for the other labs?
So the question was, we had a lot of tests, probably a record number of tests being reported over the weekend on Saturday, and do we have a breakdown of how much was that Test Nebraska versus the other labs? I don't have that data, but Taylor is working on getting that data for you, Paul.
Where are you at on the number of sites? Are you still rotating 4 around, or are you up to 6?
Yeah, so the question was, are we still rotating 4 sites around? Have we stepped up to 6 sites yet? We're still at 4 sites right now, so we still got 4 that are moving around, but we will be getting up to 6 testing sites. That's how we will get up to the total of 3,000 tests per day. But again, folks, we need people to sign up for testnebraska.com so that we can have the people so that we can, get 500 people a day through each of those tests. So sign up.
I didn't know until this weekend you had a machine that broke down on one of the analytical machines. Did that slow you down any?
So the question was, do we have a machine that broke down in the Test Nebraska lab that we're working on getting fixed or replaced, and did that slow us down? I think given the number of tests we were doing, I don't know that it had an impact on the total number of tests we were doing. I just don't know that number off the top of my head. It seems like they were able to continue to keep processing tests. And, this happens with other laboratories too. So for example, I know that last week when we were talking with the public health director in Lincoln, she was concerned because she wasn't getting her test back, and that was coming from a local area hospital, not from Test Nebraska or the Nebraska Public Health Lab. So I think that can happen in any of these labs, that we can experience slowdowns depending on volume or machines or things like that.
And I had a caller who said he's having trouble getting his test results. Apparently it's been delayed like 5 days. He called the call center twice. The first time they said, well, we got your results and we're working on it. Second time he called, the person on the phone said, it's 72 business hours. It's not 72 hours, it's 72 business hours. Is that right, or is that
So the question was,
bad information?
yeah, somebody was trying to get their test results back, said they hadn't been getting it back in a timely way, called the call center twice. The first time they said, we got it. The second time they said, well, it's 72 business hours. We'll get a clarification on that, exactly what the turnaround, my understanding was 72 hours, but we'll get a clarification on whether that was business days.
Running hours, is that your,
Excuse me?
was that your understanding, 72 running hours is?
Yeah, I think we're shooting for turning it around in 72 days, or 72 hours, just not 72 days. That would be bad. Because again, the whole point is to try and get the test results done so we can get, if they're positive, get back to a contact tracer who can then start the whole process of getting people to quarantine. So, but we'll get a clarification on that. John?
Obviously, you don't know the lost revenue of, how much the state has lost with everything, but there's gonna be some almost certainly. So how feasible is property tax reform with, obviously some amount of lost revenue, coming to the state?
So the question was, how feasible is property tax relief, given that we're going to have some loss in revenue? I think certainly that with the loss of revenue, likely with regards to the pandemic, that we're going to have to adjust expectations for what that property tax relief will look like. However, this is still one of the most important issues that we have here in the state. And it certainly was the most important before the pandemic hit. And it's still a big issue, especially for our farmers and ranchers, especially now if you look at commodity prices down because of the pandemic. Land prices haven't been adjusted for that, and so they're still responsible for those property taxes. So there's an even increased burden with regard to that. But then you've got just regular homeowners and commercial folks who are all experiencing the effects of the pandemic. There's even more reason why we need to continue to focus on trying to get that property tax relief done. So it may not look like what we were thinking but would look like before the pandemic, but I believe this is still the top priority for the legislature to get done when they come back in session.
And do you foresee the business incentive bill changing at all with the pandemic, changing things with businesses around the state?
And with regard to the business incentive bill, does that need to change as well? Well, again, I would say the same thing would have to happen with that if we're going to set expectations to be different for the property tax bill because of our revenue issues. The same thing is going to be true for the business incentive, that their expectations are going to need to be changed with regard to what's going to be able to be possible for that incentive bill based upon the change in the revenues and pandemic. So I think they both have to reset their expectations.
And by
Yeah.
resetting expectations, you mean lower the amount of relief that people are expecting with the size of the incentives?
Right, so the question, so then Fred Knapp follows up, said, by resetting expectations mean you're not gonna get as much property tax relief, you're not gonna have as much money for business incentives as you thought prior to the pandemic, and yes, that's exactly what I mean, is that there's just not gonna be enough money, at least in the near term, to be able to do the things we thought we could do, 3 months ago.
And on another subject, there was a question that was relayed to you, the premise of which was that we had reached the peak of cases. Are you prepared to say that?
So there was an earlier question that had speculated that maybe we've reached the peak of our cases. And again, we can change the number of cases we get by how much testing we're doing. If we do more testing, we're gonna find more people, and so you're gonna have more test positive. That's why I focus on the hospital data, because that doesn't really change based upon whether or not you test somebody or not. And that's why I'm focused on the hospital data with regard to where we're going. We look at the percent testing positive on cases as kind of an early indicator that we may have a spike of cases coming to a hospital system like we did in Lexington. But again, I don't really, like, I look at the number of cases we're getting, but at the end of the day, it's really about hospitalizations that's gonna help us make the decision on if we can loosen or, loosen our restrictions. So it's not a number that I pay that much attention to. Yeah, in the back. Sorry.
Yeah.
Yeah.
So you said that like ICU beds and hospital beds are about 45% availability, and ventilators are at 77%. When you were trying to flatten the curve at the beginning of all of this, is this something like numbers-wise you kind of expected to be at, or are you happy with this? Do you want it to be less? What are your thoughts?
Well, when we started this whole pandemic, there was a lot of unknowns with regard to what the hospital capacity would be. And so we didn't have specific targets of where we wanted to keep it open. So I think that being at 45% capacity for hospital beds, 40% capacity for ICU beds, and 77% capacity for ventilators. Remember, when this was kind of all popping up at the beginning of March and April, New York was saying they needed more ventilators. I think the governor of New York said he needed 40,000 ventilators or something like that. We were concerned about, making sure that we had hospital beds, ICU beds, and ventilators, and the fact that here we are 2 months later, we've got 7% of our ventilators available. That means we really exceeded the expectations of what we thought. We thought that might be a lot closer or a lot more narrow margin with regard to how much capacity we had. So I'm very pleased throughout this entire pandemic on the amount of capacity we've been able to keep in the hospital system. It's been a lot.
So you see, kind of like judging off, like, how hospitals are doing, like testing, or not testing capacity, just the hospital bed availability. Is there any reason that you would want to open things up sooner than you expected with these numbers being so well?
So the question was, is there any reason why I'd want to open up anything sooner than what we'd already laid out, given that these numbers are pretty good? I think the one thing you got to keep in mind is, again, we loosened some restrictions May 4th, and we're just now 2 weeks later. So it takes about 2 weeks from the time you do something to see that impact. So while I'm very pleased with the amount of capacity we have in the hospital system, we want to make sure that we preserve that capacity in the hospital system. So as we take steps, we're going to see what happens with regard to that capacity, and then we'll make more steps. So I'm not interested in doing anything more in a more accelerated fashion in May while we look for what sorts of steps we're going to take in June. Lee?
That 2-week marker that you give, obviously there's things that you've seen that are good and bad. Besides just hospital bed capacity, can you give some other analytics that you look at that when you're addressing this is something that maybe we can look at and say restrictions can be lifted, and look at something else and say maybe this needs to change? What are some of those other boundaries that you guys have?
Again, when it comes to what I'm looking at with regard to the restrictions, it's really focused on that hospital data, because that's really what's driving this. This is what everybody said, more than 2 months ago. All our public health experts said, hey, that's what you got to focus on. Again, this is a virus. You can't stop it from coming, but you can slow it down to make sure you preserve the healthcare system. So that's what we have really keyed on and focused on as we've been looking at how can we put restrictions on, and then how can we start loosening them back up again. So as I mentioned, we do look at things like percent positive cases testing in certain regions to see if that may become a hot spot, in which case then we have to manage the healthcare system there a little bit differently, like we did in Lexington where we moved people out. Certainly that's been true in Grand Island where we've moved people to be able to make sure we kept capacity there. And right now Grand Island's got, is very stable, got lots of hospital capacity. So that's really what we use, that percent positive testing. And then the testing that we want to do, the expanded testing, what that does is not so much, again, the number of cases, but allows us to find who is testing positive for coronavirus, get them to isolate, go do the contact tracing on all their contacts, get those people, depending on how close a contact they've had, either to monitor their systems or to quarantine themselves. And that's how we really switch the focus from doing these broader, restrictions that we have in place to focusing on the people who have been directly impacted by the virus and getting them to either isolate and quarantine so that everybody else can go back to a more normal life. That's really, how you do disease management from an epidemiology standpoint. That's been a proven tool to be able to find those people, isolate them, quarantine them, and then you slow the spread of the virus that way.
So if cities have hospital capacity that can support their local area, you would expect, those folks could expect restrictions to be lifted based on what you just said?
So the question is then that if cities have hospital capacities, you can expect a loosening of restrictions. And I think that's a fair expectation, that as we go forward into the month of June, if we continue to see that stable system, that then we would take further steps to loosen restrictions. Yeah.
Oh, yeah, okay. I was gonna ask, does the state have any data on, what hospital capacity is typically like in the months of April and May? On last year, I should say, compared to this?
Right, so does the state have any data on what hospital capacity is typically like in the months of April and May? I don't have those numbers off the top of my head. Dr. Antone, do you have any numbers on that?
I don't have them off the top of my head, but we can get them.
We don't have them off the top of our head, but we can get those for you. So can you get that for tomorrow? And we can just proactively kind of reach out and look for that. If not tomorrow, then Taylor will let you know when we can get that. Yeah, Paul.
Have you eaten to eat, and if you had, what's your impression of how people are complying with the directive?
Question was, have I been out to eat? I've been out for pizza, and actually, I would say that the restaurant has been just hasn't been crowded. So at least the places I've gone, hasn't been a lot of customers. I think people are being cautious about going back to restaurants. But doing a lot of takeout business, I might point out.
Oh, yeah. You dined in?
I dined in, yes.
And did you think, how about the wait staff and all that? What was
Wait staff was wearing masks. I think everything was done, cashier was wearing masks. I think everybody was doing it appropriately. Brandon?
And a follow-up on that, we had a question sent in, basically, is it required or recommended for wait staff and everyone to wear masks? And if it is recommended and not required, how come there's that difference, between salons?
Sure. So the question was, if you look at our DHMs, and we put things like salons and massage therapy and tattoo parlors, where it is in the DHM, you have to wear a mask. And for the restaurants, we had a DHM, but the wearing a mask for servers was not in there. It was in the guidance document. What's the difference between those? And it boils down to that, again, when you've got the salon, you've got that really close contact on an extended period of time. We felt it was important for both parties to be wearing a mask. So not only the stylist, but also the patron to be wearing a mask. For the restaurants, we're not requiring, restaurant patrons to wear a mask. Obviously, that would be difficult to eat when wearing a mask. But we put in the guidance documents that servers ought to be doing it. Now, that really strongly recommend, and if we find that people are not doing that, we may take additional steps in the future. But the idea was, we didn't want to make it so that if a server accidentally forgot their mask or got knocked off or whatever, that they would be filed with a misdemeanor, criminal offense for forgetting their mask or whatever. We wanted to make that, something that we were trying to make flexible enough to have people understand what they are supposed to be doing and understand that we expect Nebraskans to do the right thing. And if they're not going to do the right thing, then maybe we'll take other steps. But we didn't want to start with making it a misdemeanor for that server to not be wearing a mask.
Rob McCartney would like to know, is the state preparing for a second surge of coronavirus, and if so, how?
So Rob McCartney want to know, is the state preparing for a second surge of coronavirus? And certainly we are going to think about what that might look like, but right now we're really focused on the initial surge we have. And, there's been talk about a second surge. I don't know what the data behind that is specifically and why that would occur. If it is it going to be, for example, people have talked about in the fall, but what's that related to? So we'd really have to look at the data on why people actually think that might happen. Right now, that's still speculation that there'd be a second surge, and we're still working on making sure that we're doing all we can to slow the spread of the virus right here with our directed health measures. Remember, we just started loosening up our health measures here. and continue to do a good job through that process. So don't have anything that can tell you about whatever second surge might occur. Hopefully there'll be more data out, from the federal government or somebody if they actually believe that's going to happen. Yeah, Paul.
Talked to a doctor, he said he's still having trouble getting COVID-19 tests when he needs them. He said it'd be nice if he could just prescribe a Test Nebraska test. Is that being contemplated? You talked about doing that?
So there was a doctor who said he was still having trouble getting coronavirus tests when he needed it. Could he prescribe a Test Nebraska not test? It's really not the way that system is set up to be able to do a prescription from a doctor. That's not the way the Test Nebraska system works out. But having said that, we are not only, that's not the only thing we're looking to be able to expand our testing capacity. So commercial labs are continuing to expand their capacity. We continue to look for other sources, how we can do that as well through the vendors that we can get. So I would just encourage the doctor to keep working with their commercial providers they're already working with as far as getting those tests.
Have you had any luck getting more reagent or equipment for testing recently?
So the question is, have we had any luck getting more reagents? I think we are actually getting a better revenue or better stream of supplies to be able to do the reagents, not only for testnebraska.com, which we are well supplied with, but also for the Nebraska Public Health Lab and so forth. So I do feel like those supply lines are starting to get more robust and that we, at least within the last week, haven't had any issues with regard to people telling us that we're not going to be able to at least get some reagents for some of the machines that we have.
Is that state funds you're using, or federal funds? Or?
So to do a lot of the purchasing of these reagents, we are using CARES Act. Our intention is to use CARES Act money to be able to do that because it's a coronavirus-related expense.
We have time for a couple more questions.
I don't have the numbers off the top of my head, but we can work. Taylor, can you get the numbers on, see if we can break out what we're spending on reagents for the CARES Act money? One more question.
In regards to
Yeah.
Test Nebraska, do you have an overall number of how many tests have been done strictly through Test Nebraska?
Do we have a test, Dr. Antone, do you have a number for the overall tests that have been done through Test Nebraska to date?
I thought it was 7,200, close to 7,100 test results back.
Test results back. So Dr. Antone thinks it's been 7,100 or 7,200 test results that have been received back.
So that's just a
Today.
fraction of the overall number of people that have signed up. Are you hoping to close that gap between the number that has applied or signed up, however you want to look at it, and how many have actually gotten a test?
Yeah, so absolutely. So there's been over 140,000 people that have signed up. We want to continue to get people scheduled, get them in, get them tested. That's why we'll be looking to, ultimately go from 4 teams to 6 teams and start expanding that. Also remember, when Dr. Antone is talking about the number of tests received back, so there is a little bit of a lag between the time we actually test somebody and the time that test comes back in. But yeah, absolutely. We want to work to make sure that we get all those folks who've signed up, especially in the priority, right? Healthcare workers, first responders, food process workers, or symptomatic people, so forth. In priority, but we want to work through that list. Well, again, folks, thank you very much. I appreciate everybody spending their afternoon here to hear the update with regard to what the state is doing to slow the spread of coronavirus. I want to thank all the Nebraskans who have sacrificed and have worked so hard to slow that spread. It has worked. We are getting through this together. We have preserved the healthcare system. Nebraskans are able to access that if they need it. So we're going to continue to work on that. We appreciate all your sacrifices to be able to make this happen. Please consider testnebraska.com as one of the ways that you can fight the spread of coronavirus here in the state. We very much appreciate it. And thank you all so much. We will talk to you again tomorrow, 2 o'clock Central Time, right here. 5 p.m. Central Time tomorrow will be the Spanish language briefing. And then 8:30 p.m. Thursday night, NET Nebraska, speaking of Nebraska. Thanks very much, and we'll see you tomorrow.